1. So let's read the history of this case number 1. A 4-year-old boy was brought to the PEDS OPD with a complaint of aggressive behavior and a delayed in milestone. He was the firstborn of the non-consanguineous marriage with no documented history of any genetic disorder in the family of either of the parents. Antenatal period was uneventful and the child was born full term by spontaneous vaginal delivery. And his birth weight was 3.4 kilograms. And he had the spontaneous cry with the good Apgar score. But however, the developmental milestone was delayed. So the chief complaint here is delayed in the milestone with the aggressive behavior, right? Otherwise, childbirth history was also normal and there is no genetic disorder in the family. Okay. Here, Apgar score, I think this Apgar score word is new to you. It is a score given to the newborn to check the well-being of the newborn, to determine whether the resuscitation is required or not. So it comprises of the 5 components. When the baby is born, we have to see the 5 components. That is color, heart rate, reflexes, muscle tone, and the respiration. So after looking all these 5 components, scoring system is given 1 to 10. So a score, Apgar score of 7, 8, 9 are considered as a normal. So in this case, Apgar score of the baby was good at the time of the birth. Okay. So please read carefully the presenting history complaint of this child. Let's go to the next slide. On examination, the child was very fair with light color here. Okay, please notice this one. This is one of the significant findings on examination. Skin color and the light color here. Okay. Height in the body weight are appropriate. Okay, this is not significant. And on further examination, he had poor eye contact and restricted social interaction. He was, however, hyperactive with unnecessary mobility. Otherwise, the gross motor development was normal. Okay. So here in the examination, significant finding is the skin color and the light color here. Along with this poor eye contact and the restricted social interaction. These are the significant findings on the examination of the child. Now coming to the investigation. Blood and urine samples were collected for investigation. Routine investigation like complete blood count, liver function test, kidney function test, etc. And also for the amino aciduria screening. Okay. For the screening of the amino aciduria, blood and urine sample was collected. And it reveals the normal blood count. That is complete blood count, RBC, hemoglobin, WBC are all normal. Plasma glucose was normal, electrolyte and LFT, KFT are all normal. Okay, in the blood investigation. Ferric chloride test in urine sample was done. Okay, in urine ferric chloride test and dinitrophenylhydrazine test, it came out as a positive test. Urine ferric chloride test and dinitrophenylhydrazine test was positive. So this is one of the significant findings in the investigation. Okay, so in further investigation, when we do this thin layer chromatography for the urine amino acid level, it reveals a band of increased staining intensity corresponding to phenylalanine. This phenylalanine is an aromatic amino acid, right? So in the region of the phenylalanine region, there is increase in the intensity of the band in thin layer chromatography. So this is also one of the significant findings, right? And when we measure the serum phenylalanine level were 300 micromole per liter, which is above the normal range. Normal range is 31 to 75 micromole per liter. Okay. So here in the investigation, significant findings are urine ferric chloride test, dinitrophenylhydrazine test, and in thin layer chromatography, increase in the intensity in the level of the phenylalanine, and serum phenylalanine level was 300 micromole per liter. Okay, so these are the significant findings. So let's go back to the history. Child with the significant complaint of significant history of delayed in the milestone with no documented history of the genetic disorder in family, along with very fair skin color with light color here, okay, with increase in the phenylalanine level in the blood and urine ferric chloride and dinitrophenylhydrazine test positive. Okay, so the questions are, what is the diagnosis of this case? And what is the biochemical basis of the fair skin with the light color here? And the principle of ferric chloride test and dinitrophenylhydrazine test. And mental retardation is present in this case. Okay, so what can be the causes of the mental retardation in this case? Okay, so from the history, like delayed in the milestone, examination with the fair color skin and the white hair color, along with investigation with increase in the phenylalanine level in the blood. Okay, all this history and the findings are suggestive of phenylketonuria. So this child is having phenylketonuria. It is a disorder. Okay, so this is a disorder which affects the conversion of phenylalanine to tyrosine. Okay, so what is the second question? The second question is, what is the biochemical basis of the fair skin with the light color here, right? Melanin, skin pigment. Melanin is a skin pigment that is synthesized from the tyrosine, right? So since phenylalanine in phenylketonuria, phenylalanine hydrolase is absent or deficient in phenylketonuria. So phenylalanine cannot convert to tyrosine. That means decrease in the level of the tyrosine. Tyrosine is not available in adequate quantity to form the melanin, which lead to fair complexion and the light color here in this phenylketonuria case. Okay, so this is the biochemical basis of fair color skin and hair color, white hair color, that is due to inadequate melanin formation because of decrease or inadequate of tyrosine due to failure of the conversion of phenylalanine to tyrosine. Because melanin is one of the products of tyrosine, right? There are different products of the tyrosine, tyrosine can form thyroxine hormone, dopamine, melanin, है ना? So melanin is one of the product of the tyrosine metabolism. So due to the absence of the tyrosine, melanin is inadequate. This lead to fair skin color and white hair. So now the third question, principle of the ferric chloride test and dinitrophenylhydrazine test. So in phenylketonuria disorder, ferric chloride test and dinitrophenylhydrazine test are positive, right? So now coming to the principle of the ferric chloride test. So by doing ferric chloride test, it will determine the presence of the phenyl pyruvate in the sample. So the procedure of the ferric chloride test is take 5 ml of the sample in the test tube and add 3 to 4 drops of the ferric chloride solution, okay, and mix it properly. And after mixing, if there is appearance of the green or blue color, then it confirms the presence of the phenyl pyruvate. So in this way, you can check the phenylketonuria disorder by doing the ferric chloride test. Okay. And next test, that is dinitrophenylhydrazine test. It detects the presence of the keto acid in urine. Okay. Keto acid like phenyl lactate, phenyl acetate. So the procedure is 2 ml of urine is you will take 2 ml of the urine in the test tube and add equal amount of dinitrophenylhydrazine reagent and mix well properly, and appearance of the yellow PPT which indicate the presence of the keto acid. Keto acid is that is phenyl lactate and phenyl acetate, which are the metabolic product of phenylalanine. When you study this theory part, I think you have studied that phenylalanine is converted into phenyl pyruvate and further converted into phenyl lactate and a phenyl acetate. So in this disorder, phenylketonuria, as phenylalanine cannot convert into tyrosine, level of the phenylalanine will increase and metabolism of the phenylalanine will increase, which lead to the increase of phenyl pyruvate and phenyl lactate and phenyl acetate. This can be detected by ferric chloride test and dinitrophenylhydrazine test. Okay. So ferric chloride test and dinitrophenylhydrazine test are used to diagnose phenylketonuria. What is the fourth one? Achha. The fourth question is, what is the cause of the mental retardation in this case? So mental retardation is present in this case along with the developmental delay, milestone developmental delay. Okay. So mental retardation, it is due to the increase in the phenylalanine. Okay, phenylalanine will increase in the body. So increase in this amino acid phenylalanine will inhibit the transport of other amino acid. This is required for the synthesis of the neurotransmitter. Like there will be deficiency of the tyrosine and the tryptophan. And the tyrosine and the tryptophan is required for the synthesis of the neurotransmitter like dopamine and the serotonin. So there will be decrease in the level of the dopamine and the serotonin in phenylketonuria. Okay, so all these things will lead to mental retardation, and also there is reducing the synthesis and degradation, reducing the synthesis of the myelin and degradation of the myelin in the case of the phenylketonuria. So mental retardation can be seen in case of the phenylketonuria. Okay. So just some summarization of this phenylketonuria. Most important, history will be delayed in the milestone with the aggressive behavior. Okay. And on examination, you have to check the color, hair color, skin color, in order to check the melanin is present or not. And investigation may all the other routine investigation will be normal. So you have to perform the urine ferric chloride test and dinitrophenyl hydroxide test for phenylketonuria, where it will come positive. Okay. And after all, you can test the level of the serum phenylalanine level, and thin layer chromatography can be used to check the phenylalanine. So this is all about phenylketonuria. Okay. Let's go to the next case. So all these things are important for your theory exam as well as for your OSP and for your Viva. It can come in your theory exam also. So case number 2. Let's read this case number 2. A 45-year-old male presented to ortho OPD with a complaint of back pain for the past 1 year, and he also gave a history of the stiffness in his knee joint, and the symptom had gradually increased in intensity since the past 2 months, and lately he had also noticed a blackish discoloration of the palms and the nails. Okay. Chalo, we'll read again this one. Complaint of the back pain for the past 1 year. Knee stiffness of the knee joint. And most significant history here is black discoloration of the palms and the nails. Okay. Because back pain and knee joint can be due to increase in the age of this person. So the most significant history here is blackish discoloration of the palms and the nails. Striking history. Now coming to the examination of this patient, blood pressure is 132/88, heart rate is 86, respiratory rate 18 per minute, which are not that significant. Further investigation, further examination against bluish papules can be seen on the pinna and between the second and the third fingers in both the hands. Okay, so this bluish papules, significant finding on examination. Okay, and examination of the spines reveals tenderness in the lumbar region and restricted movement in all the direction. And the systemic examination and ECG, echo, USG, abdomen are all within the normal limit, not significant. So significant examination finding is bluish papules and tenderness. Okay. Significant. These two are the significant finding here. So investigation. So examination के बाद we have to do investigation, right? So in blood sample and urine samples were collected for the evaluation, and it was observed that the urine darkened on standing and became Coca-Cola like color. Okay, it darkened on keeping outside. Okay, this is also one of the significant findings. Blood sample में other findings, other routine for this I have not written here, but all the other routine findings, routine investigation of the blood samples are all within the normal limit. Here in this case, okay, the urine samples turn dark on standing. Further investigation में we did phthalate solution, and it acquires a characteristic brown black color in phallic test. And Benedict test of this patient is positive. Okay, Benedict test is positive, right? Benedict test, I think you guys are familiar with the Benedict test. Okay, Benedict test is positive in this case. Further investigation में we did histopathological examination of the biopsy from the papules. Okay, on histopath examination of the biopsy from the papules, there is presence of the ochre color pigment and hyperkeratosis. Okay, color pigment here is like it's a pigmented color containing like ferric oxide, light yellow, brown, red color pigment. Okay, and hyperkeratosis. Hyperkeratosis means there is increase in the thickness of the outer layer of the skin. Okay, so in histopath examination of the biopsy from the papules, remember in history you can see the bluish papules between the pinna and this second and the third finger के बीच में you can see the papules. So biopsy is taken from the papules, and these are the findings: color pigment and hyperkeratosis. And this is one. This is also one of the significant finding here. Okay, and remember that history of this thing, back pain and stiffness of the knee joint. For that one, X-ray, knee joint and the spine was done, and degenerative changes and osteophyte formation can be seen in the X-ray. Okay, so degenerative changes are present in the X-ray, and osteophyte formation was also present. And HPLC is also done for the to test the homosynthetic acid in urine, and it came out as a positive. Okay, it came out as a positive. So all these are the significant findings. So let's summarize this case. Back pain, stiffness in his knee joint, and blackish discoloration of the palms and the nails. Okay. This back pain and the stiffness of the knee joint can be due to the increase in the age. It's 45 years old, right? So in the X-ray finding, there is degeneration of the degenerative finding and osteophyte formation in the X-ray of the knee joint and the spine. So back pain and the stiffness can be due to osteophyte formation and degenerative changes. Okay, but the most significant finding here is blackish discoloration of the palm and the nails, and in examination bluish papules, this is present in pinna and between the fingers, and investigation phallic test positive, Benedict test positive, along with histopath examination of findings of hyperkeratosis and finding of the colored pigment. Okay, and HPLC for homosynthetic acid is positive. So these are the questions. What is the diagnosis? And what is the genetic defect present in this disease? And what is the reason behind the discoloration of the palms and the soles? Salt. And why was Benedictus positive here? And what is onchronosis? This is present in this case. Okay. So the diagnosis is alkaptonuria. Okay, alkaptonuria. How do you know it's alkaptonuria? From the characteristic history, that is discoloration of the palms and the nails, along with all this examination finding and the investigation. So it is the case of the alkaptonuria. It is the autosomal recessive disorder, right? With a defect in the tyrosine metabolism. So in this condition, there is decrease or deficiency of the homosynthetic acid oxidase. This results in accumulation of the homosynthetic acid. Okay. So there is deficiency of the homosynthetic acid oxidase, which lead to the accumulation of the homosynthetic acid. So this homosynthetic acid, this is present in the urine. On oxidation, it turns into black color. Means this homosynthetic acid, it can present in urine, it can present in your this body fluid, etc. Okay. So on oxidation, it will turn into black color. Okay. Of urine or palm of the skin color here in this history is due to oxidation of the homosynthetic acid. Okay. Let's come to the, okay, we have done with the diagnosis. Dentic defect also we have discussed. Due to the deficiency of the homosynthetic acid oxidase, lead to increase in accumulation of the homosynthetic acid. And the third one, what is the reason behind, this also we have discussed, right? And fourth one, why was Benedictus positive? So Benedictus is the test for the reducing substance. Any reducing substance can give the Benedictus positive, right? It's not only for the glucose in the urine. All the reducing substance can give Benedictus positive, right? Okay. So homosynthetic acid, which is accumulated in this phenylketonuria case, it has a reducing nature, है ना? So homosynthetic acid has a reducing nature. So phenylketonuria में, when you test the when you perform the Benedict test in the urine sample, you will find the positive Benedict test. Okay. And the last one, what is onchronosis? So the oxidized, as I have told you, this homosynthetic acid is oxidized and it gives to the black color. Okay. So oxidized black pigment. The black color is due to the benzoquinone acetic acid. This is the oxidized product of this homosynthetic acid. It gets deposited in the connective tissue like vertebra, है ना? Vertebra में all this oxidized black pigment will get deposited and this will cause the inflammation of the joints. And this can lead to the arthritis, है ना? So remember the history में there is stiffness of the joint, right? Stiffness of the joint was present in the history. He has given the history of the stiffness of the joint. है ना? It can be due to the arthritis due to deposition of this benzoquinone acetic acid. Okay. Yeah, I think it's clear. So it's all about alkaptonuria. for this striking histories like discoloration of the palms and the nails. Findings where you will see the papules, bluish and black colored papules in the skin. And examination is important because all other routine examination will be normal. Genetic test is positive in this case, and when we do the histopathic examination, hyperkeratosis, this is the increase in the thickness of the outer layer of the skin. You will see increase in the thickness of the skin. And later you can do HPLC to see the homosynthetic acid. Just one sec. So it's all about the alkaptonuria. So now coming to the, let's go to the third case. A 7-year-old was brought to the ophthalmologist OPD with a complaint of the poor vision and the photophobia. Okay. He was the firstborn of the non-consanguineous marriage. The antenatal period was uneventful and the child was born full term by spontaneous vaginal delivery. Birth weight 3.4 kilogram and the postnatal period was uneventful. There is no problem. With all the milestone achieved, normal milestone, okay? Developmental milestone is fine. And the family history is unremarkable, okay? So the chief complaint here is poor vision with the photophobia. Came with the complaint of the poor vision and the photophobia. And on examination, characteristic finding, there is finding of total depigmentation of the skin here in iris. Okay. Finding examination, there was total depigmentation of the skin here and the iris. And he also has the photophobia and the nystagmus. And the boy has very fair skin tone with the white hair, eyebrows, and the eyelashes. Okay, these are all characteristic findings. On ophthalmic examination, there is decrease in the visual acuity with the reduced iris and the retinal pigmentation. There is decrease in the pigmentation of the retina and the iris. Okay, this is also important finding here. So, a boy came with the complaint of the poor vision and the photophobia, and on examination, there's depigmentation of the skin here and the iris, along with the fair skin tone, white hair, eyebrows, and eyelashes. These are all characteristic findings. Okay. So, other routine investigation are normal in this patient. So, here bulk assay was done to determine the catalytic activity of the tyrosinase enzyme. Okay. In this assay, here bulbs are taken from the scalp and catalytic activity of the tyrosinase was measured, and it came out to be negligible. Okay, that means tyrosinase enzyme is activity of tyrosinase enzyme is not present. Okay, this is one. This is also one of the important findings in this case. So the questions are: what is the diagnosis And why were the hair and the iris depigmentation? Depigmentation is present in this case. And why was visual acuity decreased? Vision is decreased in this case. Okay. So after compiling all this history, examination, and investigation, will make the diagnosis. So the diagnosis of this case is albinism. Okay, albinism. So albinism is due to the deficiency of the tyrosinase enzyme, right? So there is deficiency of the tyrosinase enzyme in this case, and this tyrosinase enzyme is responsible for the synthesis of the what? Melanin, that is pigment. Melanin, which is pigment. This is melanin, which is responsible for the pigmentation of the hair, skin color, and iris. Right? So in this case, there is deficiency of the tyrosinase enzyme. So in this here work to check the catalytic activity of the tyrosinase, it is negligible. The tyrosinase function is not there. Okay. So it's a case of the albinism. Okay, now here the question, second one is why were the ear and the iris depigmented? Due to the deficiency of the melanin, as melanin is formed from the tyrosine. Tyrosine enzyme is not there, so tyrosine cannot convert into melanin. Okay, and why there is decrease in the vision? So macula is structure present in the eyes. The pigmentation of the macula is affected in oculocutaneous albinism. This is one type of the albinism. Okay, oculocutaneous albinism. So pigmentation of the macula is affected. So in oculocutaneous albinism, this will lead to the decrease in the vision. So this is all about albinism. Let's go to the case number 4. A 55 years old woman presented to OPD with a complaint of palpitation, nausea, diarrhea, and weight loss for the past 1 month. Okay, complaint of palpitation, nausea, diarrhea, and weight loss for the past 1 month. And she also complained of occasionally flushing episode. Okay, and there is no history of fever and no history of other comorbid condition, other illness, and family history was not significant. Okay, so these are the chief complaints: palpitation, nausea, diarrhea, weight loss, with the occasional flushing episode. These are the history. And on examination, the patient was conscious, afebrile, pulse rate was 92 per minute, and with higher, this is on the higher side. BP is normal, present of the feather, and red flush was noticed over the face, and other systemic examination are all normal. Pulse rate increase here, and these are two significant findings. So on investigation, hemoglobin, means on examination, pallor is present. So hemoglobin is less 9.2 gram per deciliter. TLC is almost normal. Urea creatinine 34 milligram per dl and 1 milligram per dl. These are normal range, normal urea and the urine, and this ALT, AST, ALP with comes under liver function test. These are all normal. है ना? So further investigation में urinary 5-hydroxy indolic acid was done. So urinary 5-hydrolic indolic acid, the values came out as 320 milligram per 24 hours. चलो हाँ क्या इन्वेस्टिगेशन में हीमोग्लोबिन इज 9.2 ग्राम per dl and kidney function test, urea, creatinine, these are all within the normal limit. LFT means liver function tests are also normal. Positive finding is urinary 5-hydroxy indolic acid. Normal level is less than 10 milligram per 24 hours. And it came out as 320 milligram per 24 hours. ठीक है 5-hydroxy indolic acid, remember this substance. And on CT abdomen, CT scan abdomen, mass lesion can be seen in the small intestine. So this is also one of the important findings here. ठीक है this is also one of the important finding here. और प्रॉब्लम नहीं है इसमें, बस women presented to OPD with a complaint of palpitation, nausea, diarrhea, weight loss, and there is no other comorbidity. ठीक है so these are the complaints: palpitation, nausea, diarrhea with weight loss. Along with urinary finding along with this positive urinary finding with the CT scan of suggestive of lesion in the small intestine. Okay. So from all this, from the history examination to the history examination and investigation, you have to means decide what is the diagnosis and what could be the biochemical basis of the patient complaint, and what is the significance of the CT finding, CT abdomen, and what is the significance of the urinary finding. And these are the questions of this case. So this is the case of the carcinoid syndrome. Okay. So this is the carcinoid syndrome. It is caused due to the neuroendocrine tumor that arise from the enterochromatin cells of the intestine. So mostly this neuroendocrine tumor is present in the intestine, like appendix, stomach, rectum, colon. Okay. So in this neuroendocrine tumor, lots of serotonin is produced. It's basically the serotonin producing tumor, and mostly located in the GIT, like appendix, stomach, rectum, and the colon. And it is known as the serotonin producing tumor, and it will sign and the symptom of increase in the serotonin level. So this syndrome is known as the carcinoid syndrome. Okay. So carcinoid syndrome, it is a neuroendocrine tumor arising from the enterochromatin cells. And serotonin is the most common amine secreted by this tumor. And all the symptoms that complaint of this patient, like diarrhea, palpitation, diarrhea, nausea, it is all because of this serotonin, increase in the level of the serotonin. So, in this condition, that is Carcinoid syndrome, normally around 1% of the tryptophan, serotonin is formed from the tryptophan, right? So normally 1% of the tryptophan is converted into serotonin. But in carcinoid tumor, 50 to 60% of the tryptophan is converted to serotonin and causing all these symptoms. Okay. What is the question next? What is the significance of the CT finding? है ना? CT scan करने के बाद there is a mass lesion in the small intestine. So this lesion in the small intestine is the suggestive of the tumor, small carcinoid tumor. Okay. And last question was, what is the significance of the urinary finding? Urine finding में this presence of 5-hydroxyindolic acid है ना? So this 5-hydroxyindolic acid is the breakdown product of the serotonin. So in this carcinoid syndrome, more tryptophan, 50 to around 60% of the tryptophan converted into serotonin. Okay? And this serotonin, more serotonin is present. So that breakdown product of the serotonin, that is 5-hydroxyindolic acid, is excreted. So this lead to the positive test of increase in the 5-hydroxyindolic acid in the urine examination. Okay. So this is case number 4, the carcinoid syndrome. So if you got this history of palpitation, nausea, diarrhea, weight loss, otherwise other history are not significant, fever, these are all non-significant history. So women with palpitation, nausea, diarrhea, weight loss, along with CT, men important is CT finding, you can suspect of carcinoid syndrome. Okay. So this is all about carcinoid syndrome. Let's go to the last case number 5. Okay. This is the last case of amino acid metabolism. Last case of today's class. Okay. So case number 5. 11-year-old girl presented to neurology OPD with the gait difficulty. Okay. Mother also gave the history of surgical intervention at the age of 7 years for the poor vision. Okay. So these are the main complaint: difficulty in working and poor vision. But there is no dysmorphic feature of the face. Okay. And medical record means history may it reveals that the C has been operated for the lens dislocation. So this is also one of the important history. Give us a history of the motor difficulty in the elder brother too. Elder brother also has some kind of the problem like difficulty in motor function. And the parents were related to each other, and hence the marriage was consanguineous. And there is no history of any seizures. So all this history are significant. difficulty of the posture, get poor vision, lens dislocation, है ना? These are all significant history and also significant family history. ठीक है? So these are all significant history of this case. Coming to the examination, on physical examinations, this bully here, one of the significant findings. ठीक है? And the chest showed the characteristic gap in appearance of the sternum, है ना? One of the findings is also high arch palate along with thin extremities and arachnodactyly spider-like fingers. है ना? These are all significant findings. For the examination में palate edema, icterus, these are all absent. And on neurological examination, it reveals the tendons reflexes, the tendon reflexes are all exaggerated. Okay. And due to unsteady Deficiency needed support for standing up from the sitting position, means the child cannot stand up alone. He needs support. Okay. These are all significant findings. Now let's come to the investigation of this child. Blood sample was collected and sent for the complete blood count, liver function test, elective liver function test, TFT, thyroid function test, है ना? LFT, TFT, calcium serum B12, they're all within the normal range. So serum homocysteine level was measured and it came out as 202 micromole per liter. This is significantly high. The normal range is 4 to 6 to 12.44 micromole per liter. Na? So this is significantly higher site mein hai. And serum methionine level is also high, 523 micromole per liter. Okay, normal range is 0 to 90 micromole per liter. Okay. So after all this investigation, the patient was treated with a high dose of oral pyridoxine. है ना? Pyridoxine से treatment is given by giving the high dose of oral pyridoxine and put on methionine restricted diet. Okay. After this treatment, after giving pyridoxine and methionine restricted diet, he was followed up monthly. Every month follow-up was done. And on clinical evaluation to see the response to the treatment. So after a month, she attained the ability to stand and walking without the help. That means the treatment is responsive. Na? After the few months of the treatment, now she can stand by her own. Okay. So these are the history and the findings of this last test, case number 5. So the question here, what is the diagnosis and what is the significance of measuring vitamin B12 level? ना vitamin B12 level भी तो measure किया था ना वहाँ पे serum B12, but it came within the normal range. And what are the implications of the increase in the homocysteine level? है ना? Homocysteine level is increased here 202. What can be the possible outcome of this increase in the homocysteine level? And for treatment, pyridoxine was given. है ना? So why pyridoxine is given for treatment of this patient? Get this other question. So this is the case of the homocystinuria. Okay. So homocystinuria we have done with the amino theory classes lecture of the amino acid metabolism. So you must be knowing, है ना? So homocystinuria, it is a disorder of the catabolism of the methionine. Homocysteine. Okay, methionine catabolism defective here. Here means homocysteine can be converted into cystathionine and methionine, right? So, conversion of homocysteine to methionine is effected due to the defect in the various enzymes. This is involved in this metabolism. Means types of the homocystinuria you go through your books, okay? So different type are there, type 1, 2, 3, 4, depending on the enzyme defect. Okay? In all these types, homocysteine to methionine conversion is affected and level of the homocysteine will be increased in the body. है ना? So this is the disorder of the catabolism of the methionine. Homocysteine cannot convert to methionine, so there is increase in the excretion of the homocysteine, and also level will be increased in the blood. Both homocysteine and the methionine level will be increased in the blood. And some of the findings of this homocystinuria, typical finding of this homocystinuria are ectopia lentis, है ना? Dislocation of the ectopia lentis. Okay. So ectopia lentis is the abnormal displacement of the eye lenses. Lenses are present in the eyes, in our eyes, है ना? So displacement of the eyes lens into the posterior chamber of the eye. So this is known as the ectopia lentis. When we go back to the history, see, there is a medical record revealed that he has operated for the lens dislocation. है ना? So this dislocation of the lens is known as the ectopia lentis, and it is the one of the important finding of the homocystinuria. So all these typical findings you have to remember: dislocation of the lens, ectopia lentis in the homocystinuria, along with other features like Marfan-like syndrome. Marfan-like syndrome में long arms, fingers, arachnodactyly will be present in this Marfan-like syndrome. Okay, so these are all the feature of homocystinuria. Okay, and second question was, what is the significance of measuring the vitamin B12 level? Nah. See, vitamin B12 defect is defect is in the conversion of homocysteine to methionine due to defect in various enzymes. Nah. So conversion of homocysteine to methionine required vitamin B12, right? In the form of the methyl cobalamin, है ना? Vitamin B12 is the coenzyme required for the conversion of homocysteine to methionine. So in this condition, measurement of vitamin B12 is required. But if there is deficiency in the vitamin B12, then conversion of homocysteine to methionine will not occur, and this can lead to the homocysteinemia. Okay, so vitamin B12 measurement is required in this case. So what are the implications of the increased homocysteine level? Means, okay, increase in the homocysteine level can cause increase in the vascular thrombosis and embolism. These are the outcome of the increase in the homocysteine level in the blood. It can lead to increase in the vascular thrombosis and embolism, with a risk factor for the coronary artery disease and the cerebral stroke. So in coronary artery disease patient, means homocysteine level can be measured. So this is one of the risk factors. So outcome, the implication of the increase in the homocysteine is that it can increase the vascular thrombosis and embolism. It can lead to coronary artery disease. Okay. Coronary artery disease, like will include this myocardial infarction, can also increase in the coronary artery disease, and stroke can also happen. So the last question: why was pyridoxine prescribed in this patient as a treatment? Treatment may remember this pyridoxine was given. This patient was treated with high dose of the oral pyridoxine, है ना? on methionine restricted diet. After the treatment with pyridoxine, improvement can be seen in this patient. है ना? Treatment is responsive. So why pyridoxine is given in this patient? ठीक है, pyridoxine is vitamin. When we use study vitamin, we will come. Pyridoxine is vitamin B6. So pyridoxine is a vitamin which is required as a coenzyme for the conversion of homocysteine to cystathionine and then to cysteine. Remember when you go through this metabolism of the homocysteine can convert into methionine with the help of the methionine synthase enzyme, है ना? And also homocysteine can convert into cystathionine with the help of the cystathionine synthase enzyme. So in this reaction, conversion of the homocysteine to cystathionine, pyridoxine B6 is required as a coenzyme. Okay. So after treatment with pyridoxine there is improvement in the symptom. Okay. So pyridoxine is given in case of the homocystinuria. Okay. So now that's the end of the case discussion for today. So we have discussed 5 cases, that is phenylketonuria, alkaptonuria, albinism, carcinoid syndrome, and homocystinuria. Okay. So that's it for your PBL. And next class, I think Dr. Smita ma'am will take class at 11:15. So for 15 minutes you take rest. Okay, you can log in at 11:15. Okay. Thank you.